Hey friends, welcome back to Happy on Purpose. I'm your host, Jeunesse, and today we're diving into a topic that so many people struggle with, but very few talk about honestly. How to build a fulfilling, meaningful life, even when your body isn't cooperating. My guest today is Chantelle Fairbrother, Executive Director of the Rudy Health Resource Center, a community-rooted organization offering programs, tools, and support for people living with chronic health conditions. Chantelle has lived with health challenges since she was a teenager, and instead of letting that define or limit her, she's developed a framework she calls Living Despite, an approach that blends acceptance, practical problem solving, and deep compassion for the reality of chronic pain. Her work is about more than coping. It's about belonging, agency, and living a life that still feels yours. I can't wait for you to hear her story and the incredible work her organization is doing. Chantelle, welcome to Happy on Purpose.
Thank you. Thank you for having me.
Yeah. So we are going to keep it to about 30 minutes. So let's just dive in because
Sure.
I'm excited to actually learn more too. I don't know a lot about what you do here, so I'm going to learn with the listeners.
Excellent. Sure.
Yeah. So how can you take us back to your personal health journey, whatever
Sure.
you're comfortable sharing,
Sure.
when it started and how it shaped the way you see yourself and your life?
Sure. I had experienced pain in my joints from a young age, about 12 on. When I was 18, started my first semester of university, ended up with extreme pain and swelling in my elbow to the point of being in the emergency room for Thanksgiving.
Oh, boy.
And that sort of started that journey and that exploration as to what was going on. Many diagnoses happened over the years because it's hard to track sometimes when it's an autoimmune disorder.
Oh, yeah.
And so lots of learning and growing. But I think the critical point in my life in that journey that switched me into not being the victim, but pushing forward and finding meaning in life was a doctor telling me that by the time you're 25, you'll be in a wheelchair.
Oh, boy.
I was 19 and went, not happening.
Good girl.
And had an amazing physiotherapist at the time who I've bumped into over the years and said, thank you for saying, what do you mean a wheelchair? Like, really? You're not, if you give up, you'll be in a wheelchair. So that was a really big piece for me. Was studying psychology in university and was fascinated with the whole nervous system and how our body processes pain and processes medication. And so it was a really great platform for me to learn about self-advocacy because I had my own health issues and surgeries happening, but also research and knowing that there's information out there and how do you get it and where do you look for good resources. So that was in the 90s and move forward and was working as a career counselor for people with disabilities in the early 2000s and was just wishing that there would be an organization out there that could help people navigate the healthcare system, teach them how to be their own self-advocate around health issues, and help them with paperwork and help them with understanding their health condition. And nobody did that. I went off on mat leave, came back, and still it wasn't existing. Approached a bunch of nonprofits and said, would you like this program? And they said, yes, but that's going to be a program all its own. And so in conjunction with a friend of mine, Tracy Hamilton, who's a registered massage therapist, we founded the Rudy Health Resource Center.
I love it.
And that's just sort of where the basis was, is we just kept seeing a need in our personal lives, but also in our professional lives where people needed somebody to meet with in person to help them with the paperwork, to help them figure out how do I get what I need? How do I advocate for my family member?
Absolutely.
Yeah.
I think, and what's interesting is even your journey was the 90s. There was no internet.
No.
There was no plethora. I think almost now we have too much Google information. So it's nice to have those people, those professionals like yourselves that saw a gap.
Yeah.
Right? The best businesses are.
Yes.
That saw a gap, something you wished you had, and then just get down to the business of creating it.
Yeah.
That's amazing.
When you're working as a career counselor with somebody with a back injury and they don't know anything about their injury other than their diagnosis title, it wasn't in our scope of practice to be helping them, but there was nobody else to do it either. So that's where the Health Resource Center came about.
I think that's amazing. Having been through that myself, like when you're already dealing with it, the last thing you want is to be directed to the government website,
Right.
because good luck,
Yeah.
right? And even when, if you're a very intelligent, you could be a master's or a PhD. This is different. You're
Yeah.
dealing with the uncertainty of the
It's
illness.
your emotions are involved.
Right. So just
Yeah.
having somebody there to walk you through it, it's not about not being able to do that.
Mhm.
It's that we need support when we're going through
Yeah.
it. Yeah.
The very first person that came to our agency after we opened was a woman who had worked as a nurse in the oncology unit for 22 years and had
Right.
just been diagnosed with cancer. And I said, "So what are you doing here?"
Right.
And she's like, "I didn't hear a thing he said. What do I do?" And so we had to create a plan where she could follow the plan. This was not new to her. She knew all of these things. These are things she coached her own patients on as a nurse. But she needed somebody to help her through it because it was about her personally, and it was so close to home. And she said, my emotions were up here, and I just couldn't process the information.
Exactly.
So, and whether it's about for yourself or you're helping a family member.
Yeah.
88% of the people we see are actually not the ones with the health issue. It's their family member.
Because they're the ones that are being tasked with a lot of this stuff.
It is.
Yeah. Which I think that's a good point to sort of say it again, is that there is those services for the caregivers. This is not necessarily just a resource for the ill or the chronically ill or the people with a new diagnosis. It's not for the underserved populations. This is a resource.
Anybody and everybody.
Yeah, everybody and anybody. And is it a free resource?
It is a free resource.
Amazing.
Yeah. So the amount of hours we have in our office for the one-to-one support varies depending on our funding.
For sure.
We don't have core funding because we don't fit under any national organization. We're completely unique. There is something similar in some other communities, but not identical.
Right.
And we're funded through grants and fundraisers and donations.
Grant writing, that's a whole nother thing.
It is.
Yeah. So I wanted to get into the living despite, because that's actually how I got to know you, and I got to know Carrie as well, which you can speak about her and how she's involved. Was attending one of the living despite. And what I loved about that is it fits my whole way of being in the world, that it doesn't, you're going to have stuff happen to you. It always does. But a chronic illness or a new diagnosis or any of that is so new. And at first I was hesitant to go because I thought to myself, I don't want to be in the I'm sick category.
Right.
The denial, the grief process, the denial. But as soon as I got there, I was like, this is it. Like, you need to hear those stories of other people that are not just surviving, but thriving.
Yeah.
Then that this is not a sentence to being bedridden or a sentence to being not on purpose anymore.
Right.
Yeah. So tell me about living despite, and what does that mean to you personally?
So even before I met Carrie, I had taught various workshops on living with chronic pain and what that was, and had just met so many people that got stuck with at the stage where I'm going to leave this to the doctors to cure me, solve me, fix me, whatever the term was. And they just sort of stayed there and waited there. They didn't do anything proactive on their own part. They didn't take responsibility. And it's really hard for a doctor to be laden with that.
Absolutely.
Where they're there to diagnose and prescribe. They're not the ones living with it at home. And so I just kind of saw it as, this sort of a pyramid that you can get stuck there, or you can start to take responsibility and, maybe search out, is there a physio you can go see? Is there something you can be doing exercise-wise? Is there medications? Is there, meditation? What's it going to work for you? And so taking that kind of responsibility. And then the next stage was kind of putting those pieces all together. But then there's a level of acceptance where it's like, okay, I have arthritis, but the arthritis doesn't have me.
Lovely.
And I have blue eyes. Blue eyes don't define who I am. That's just one of my features. And so there's that level of acceptance. And then there's a level of acceptance after that. And I have met these people over the years where they have taken their health issue and made good things come out of it. I mean, we can all think of somebody like Rick Hansen, right? Yes. There's a perfect example of somebody who was not defined by his injury, and instead has turned it around and has done good for other people which he probably would not have done had that not
Agreed.
happened.
Yeah.
And I think that sort of was sort of in my mindset for many years now, was that, people can move beyond their illness, beyond their injury, their health condition. And then I met Carrie Woodsky, and she came into my office and said, I'm looking for some space to run a chronic pain group. And I went, oh, so you're a nonprofit? And I asked all these questions, and no, she was doing it out of the goodness of her heart and a passion. And I said, well, do you want to be one of our programs? And then you're covered under our funding, you're covered under our insurance. And so she was running a once a month chronic pain group that was all about information and resources. And truly, she wanted it to be about helping people live despite. And after a couple of years, we've decided that we wanted to change the name and not call it chronic pain, because not everybody associates chronic pain as their illness.
Yes.
It's just part of. So we kind of broadened it to chronic conditions and chronic pain. And then I said, we need to rename it. And she was in agreement. She says, yeah, I know. She says, I wish people could just live despite. And I said, that's it. She's like, that's it.
Yeah.
Because that's what we want people to get out of it is, yes, you can come and listen to professionals from various backgrounds, talk about treatments and tools that you can try that may or may not help you. But the whole goal is to still live your life, to still enjoy the things you enjoy. It might look different. It might be. But if you really want to go to that family function, what do you need to do to get there? And I had a recent experience with that. I had a slip and fall injury, serious injury to a muscle in my body. But I really wanted to do this long road trip with my family last summer. And so
those two things do not go together.
And I was dreading being in the car for hours on end every day. And so I knew that to get there, I had to do X, Y, and Z to do that. And so I did. But so it wasn't that I was privileged that I got to do those things. It was that I worked hard and figured out what I had to cut back on and what I had to push on in order to keep my health at a place where I could do that experience.
Yes.
And sometimes people are, when they're stuck at those lower places of, wanting other people to fix them, it's hard for them to realize that when they see other people thriving, there's this sense of, well, you shouldn't be.
Yeah. Yeah.
Or you can't be sick, or you can't have a chronic health issue.
You're doing all these things.
Right? But it's, what are you doing in exchange to be able to do those things?
Yeah, I completely agree. Early days, I had to have that conversation with a few people of like, what does this mean for me? Right. And there was, some people would say, well, you just have to accept it and kind of, that's just your new lot in life. And I was like, oh, heck no. Like, no. And then there's the people that, there are some people that really feel like their illness is a part of their identity. And that's okay too. That's, I feel like those are ages and, or not ages and stages, but stages. Maybe even of the grief process or whatever they're going through. But that doesn't mean that by, if they showed up to living despite, which is what I got out of it, was you get just that little nudge to look at it a little differently. Yeah. You had mentioned, and you can tell you're a counselor, you have a psychology background, but you had said something about your own hierarchy, Maslow's hierarchy of needs that you put together for this.
I did. And that's sort of that, denial that you're sick. Then you go to the doctor and then you expect them to fix everything. And then there's the, okay, are you going to actually do something about this and look at other options, not just whatever. Here's your diagnosis. Here's a name for what you have. Are you going to stay there, or are you going to do something about it? That doesn't mean you're going to get a cure, but how are you going to live with this? Learning to live with it. I've worked for many years with stroke survivors.
Okay.
And I really saw people get stuck at that stage because they're like, well, this happened to me. You're right. And it happened in a split second. But do you want to stay there, or do you still want to live? And I don't mean just be alive, but live. Yeah. And so then there's sort of that other stage. And then it's just continuing to build and get closer and closer to a level of acceptance that you've incorporated your health issue into your whole being and can live a fulfilling life. It may not look at all what you thought it was going to look like, but what can that mean?
Yeah. For me, I know this is maybe a controversial thing to say, but and I've heard cancer survivors and people that have gone through things, the gifts that I got from having to slow down and re-look at all the places in my life that maybe weren't in alignment anymore. I feel like I was just so in the busy doing part that when I got ill, first, of course, you have to go through that. But then there was a period of time where I was like, well, who do I want to be now with it?
Yeah.
And a lot more self-care,
Right.
a lot more time to self, reflection, boundaries, all the things that we know we need to do.
Right.
But when you get sick or you hear those words of diagnosis or whatever, you kind of get a reprieve, a little reset. If you want to look at it that way, it's so much mindset stuff that goes on.
Yeah.
Not trying to diminish or dismiss when people are really sick.
And when you're in that stage of, oh, poor me,
Yeah.
is okay, because we're all there. And
happens.
it's not a straight line that you don't go back to. You still loop back to it.
100%.
And it's interesting when we work with people at the Health Resource Center, they're like, I hear them say, so what if I need help in a year now? Great, come on back in. They're like, really? Well, yeah, your life's going to change. It could happen again. Something could happen and you have questions that you need help finding the answers to.
Yes.
So, we know that life is never a straight line. So why should health issues be a straight line?
Yeah. Yeah. And it's very complex. And not just the illness being complex, like you said, autoimmune or any chronic condition, but the process that you're going to go through is very complex. I know at Living Despite, the last time was Amy Hamilton, and she's a counselor here in town that also talks very much about that, the emotional side of just getting through the illness. And I agree. I had a therapist. Even though I am a counselor, I needed a counselor because I think you addressed it earlier. We don't know when you're in that emotional state, none of the training, nothing that you've learned matters. It's like, okay, that was really good for my clients, but now all of a sudden it's like, oh, shoot, I gotta, learn it for myself.
For sure.
Yeah.
And we want people to thrive wherever they're at. And that looks different. Thriving for one person might be going on vacations. For another, it's walking to the end of the street.
Excellent
right?
point.
And so we can't judge what that thriving looks like for any one person. And it's going to change over their lifetime, over the week,
Yes.
It's going to change depending on where their health is at.
Yeah. The seasons, whatever's going on.
Yeah.
So that's why the resource center, like you, I'm hearing that it's all stages.
It is.
Anytime. You don't get a one and done. You don't get like you have your $20 voucher that you can use here.
Right.
And that's
not like that
it's
at
not
all.
like that.
Yeah. And sometimes people come in and they're coming in and they're looking for information for their mom or dad because their mom or dad have had a catastrophic health issue happen. Yeah. And then we'll see them again because now they're comfortable and they'll come in and ask about their own situation. Yes. Or they'll ask about, now I'm really in a significant caregiving role. Now what? So we do see people repetitively and at different stages and for totally different questions.
Yeah.
Yeah.
I think what you guys are doing is so amazing.
Yeah,
really.
For us, health is physical, emotional, mental health, spiritual health. So no question is off the table to walk in our door and ask us.
Mm-hmm. Yeah. And completely confidential, I'm guessing.
Confidential, yeah. And we don't keep you as a case file. Okay. So you come in, you ask questions. We'll keep your phone number on file just for as long as we need it if we need to get back to you on something. But the intention is we're not here to manage your life. We're here to get you the supports you need or get you the services you're looking for, get you the information you need, and empower you to be able to be in control of your healthcare.
Yeah, empowerment. Yeah. So amazing. What are some assumptions or myths about chronic illness that you wish we'd release as a society? We kind of have said a few of them, but I think it's always worth the idea of those assumptions or myths.
That you're weak if you have a chronic condition. And that it's your fault somehow. You did something wrong. Those are two of the big ones that I see people even putting on themselves. Yeah. Yeah. And those put up some pretty big barriers to moving forward in life.
I would imagine there's that, well, if I had only, not eaten so many fatty foods, or if I had just done what I knew to be, exercised and whatever, or wore proper shoes before I slipped on the ice and, broke my back or, whatever it is, I completely get that. Yeah. There's that assumption for ourselves that we did something. Right. But I think there's the greater assumption that some people or some societies, it's changing, thank goodness, but that you're now somehow not as valuable. Right. Yeah, I hate that one.
Yeah, and not as valuable. So you're seen as weak and you're not contributing.
Yeah.
And
Mooching
over
off
the
the system.
years, when I've worked with people who are trying to go back to work after a chronic condition has been diagnosed or an injury, and when you ask them, like, so where's the value in life come from? They're like, well, that I make this much money and I have this kind of title. And that's a whole separate counseling session out
Absolutely.
there. But that comes from the fact that the society looks at people that if you're not well, you must have done something wrong, or you're not contributing.
You're not contributing.
That, like, again, let's go back to Rick Hansen. Can we say that he's not contributing because he uses a wheelchair? Absolutely not.
Yeah.
Right?
No, there's so many. There's a young surfer that she lost her leg, I think, and she's gone on to great things. There's so many people. I mean, I wish I had a list.
Yeah.
Right? But yeah, there's so many people
And
that
it
go
doesn't even
on.
have to be great things that are huge. The great thing could be, okay, so you have a new diagnosis and you're at home, you're not out working. So how does that affect your family? Is there a benefit? So to look for the benefits and the value when your life changes.
Totally. I used to say to clients all the time, if you just got really scaled it down to the 10 most important people that are in your immediate life and focus there, everything else will get bigger and expand. But somehow, we love to say in society, our friends and family are first, but we'll put career and making money and the grind. I think that is one of the gifts maybe of having a chronic illness, is you get a different perspective.
Yeah.
And I mean, I love that.
Yeah.
That's the spiritual side of me that comes out every now and then. But I think we are so much more valuable than what we can contribute or how we perform. As Wayne Dyer says, we are human beings, not human doings.
Yeah.
Yeah. Right.
Yeah.
So for the people that don't know, what makes the John Rudy Health Center stand out rather than, say, Nexus or the hospital or having a social worker or...
Yeah, I think there's a number of things. One, anybody and everybody can access this. Yeah. So you don't need to fit into a little box or a category. Okay. So it doesn't matter if you're male or female, young or old, have income, don't have income, or of one race or another. Like none of that matters. Anybody can walk in here. We had somebody come in and they said, I'm new to the country. I don't have full citizenship. Okay. Yeah. What's your question? So it that sets us apart from a lot of agencies and programs, because it doesn't matter. Yeah, there's no guideline. There's no minimum requirement to enter. Right, exactly. Yeah. So that definitely sets us apart. That we are not government funded or government structured, I think also sets us apart, because we have people come in that are like, they're fed up with the healthcare system. Yes. So they're looking to find supports, but they're like, but I'm tired of dealing with my doctor. I'm tired of dealing with, maybe they've been connected with a social worker at the hospital. Unlikely, unless they've been in the hospital. So they're fed up and they're angry. So they get to put that aside when they come in our door, and we're focusing on what is it that they don't even have to know what they need. They just need to know what they're struggling with. Yeah. And then we can help them figure that out. So I think that is the other piece, is that people don't need to come in and say, I need this paperwork. They can just come in and go, I'm at a loss. Here's what's going on in my life. And then it's our job to figure out what it is that could help them. Yeah. Make that as a suggestion. And then if they want help following through, helping that. Right. So we're not a resource center, which again is different from other places, that has just brochures on the wall and pick that up and out the door, right? That's not what we do. We sit down with people, we figure it out what they're needing. If they need to make a connection with another agency, let's do it together while you're in the office, because you're 95% likely to follow through than if I give you the number and tell you to do it yourself. Yeah, that's awesome. So there's that piece. People don't need to know how to read to come here, right? If that's where they're struggling, is because they need to do paperwork, or the doctor has handed them a form or an information page and they can't read it. Well, come on in. We'll read it for you. Yeah. We'll go over it. No judgment. Yeah. So I think that some of those things, we've recently received a grant to make our services more accessible. Excellent. So we're in an accessible building, but that means making our documents, our brochure, accessible for people with visual impairments and with learning disabilities. Absolutely. So they look boring, but that's because there's only the information that's needed on there, and the font is big, and there's no clutter. We're making our services more available online, because we know that in person is best, but if you can't come in, we still want to be able to provide the service.
Yeah, wonderful. When you were talking, something came up for me. When you're first diagnosed, you hear a lot about this, the medical gaslighting too, right? So for people that have been through seeing doctors or many not being believed, a lot of chronic invisible illnesses are that way, that it might just be in your head. Again, putting it on shaming, essentially, the patient, that if they had just, if they just do these things, whatever, there's a little bit of that goes on. So what I'm hearing is, even if that has happened and you're not even really sure, you just know, right? I've got something going on for me. My doctors aren't really believing me. At the John Rudy Health Center or Resource Center, you could even say, well, have you talked to this person, or what about this?
And we'd probably start with some basic information on self-advocacy and health literacy, about what that means. And so that the person is going into that next medical appointment prepared.
Perfect.
And you're prepared. And some people get annoyed with this, but I want you to go in prepared to meet the needs of the doctor. So they have 7 minutes or whatever it is to meet with you. They only want to talk about one thing. Okay, so go in. We can help you create a script. We can create a list. What is it that we need to do so that you can make the most of it, so you can feel heard and that you can be heard? Sometimes it's just changing those few things. And some people are annoyed that, well, they should accommodate me. That would be great.
That would be wonderful,
right? But that's like going to your mechanic and saying you should accommodate me. You're not. You're asking the mechanic to fix the car their way.
Yes.
So I think some of what we would do in a case like you suggested is, what tools can we give that person so that they can feel in control and can make a change in how they're being perceived?
Yeah, that is absolutely invaluable. Yeah, for sure. So what could somebody, so say they hear this interview, they Google you and they find you online, they know they need some assistance. What is sort of the process?
Yeah, I mean, the easiest way is, if you have access to email, send us an email. Describe a little bit about your scenario, and then we can get back to you. We're not open 40 hours a week, so that you're most likely to get a response really quickly. The other option is to phone, leave your name and number and a short message, and we'll get back to you within a week.
That's the commitment, the week.
The week is the commitment.
Knowing that, yes, you're not 24/7. It's not a crisis line or whatever.
And that, if it's we have people say, hey, I need transportation to Kelowna tomorrow. Well, we can't do anything in a 24-hour turnaround. We're not a crisis center. But if you have a deadline, then let us know what your deadline is. I have a doctor's appointment coming up in 2 days. It's not that we haven't listened to the messages, but we're going to prioritize.
Course,
and if somebody says they have a doctor's appointment in 2 days and they want to be prepared, then that's our first phone call. And get them.
And that could even be done over the phone.
It can,
like, do you have a notepad and paper? Whatever.
We
These
check
are
with
key
people,
things
and if they can do it over the phone, then great. Or if it needs to be a Zoom, that's okay too.
Right.
It doesn't have to be in our office, but we just know that in person is always best.
Yeah.
What happens quite often, people come in with one question or scenario and they leave with the answers to 10 more that they didn't know they had.
Yes.
So they've left, and we probably won't need to see them for a while because they've got information for what's coming. And that's just from years of experience in terms of, okay, here's the next 3 steps that are going to come up when you are going through this diagnosis process or treatment process. And so we can prepare them for what's coming.
Yeah. It makes me think you guys are really not hand holders in the sense that, come along, but you're lighting the path so that it's just an easier, smoother way of getting things done. We need those supports.
We had a board member a few years back who described it as, if you were on a ship and it starts to sink and people jump overboard, but not everybody took their life preserver with them. Our job is to shine a light on the life preserver so they know where to swim to get the life preserver.
Yes.
We're not the life preserver. We're not the ones that are going to solve their problems, but we can connect them with what will.
So very good distinction.
Right?
Very good distinction.
Yeah. So we're not the experts in all things health. We're trying to be the experts in health literacy, helping you find, understand, and use health information and services.
Yeah, connecting those dots.
Yeah.
Oh, that's amazing. We're already at 30 minutes. It's amazing to me how it can go
It
by.
does fast.
Yeah. So what is the bigger vision for your work or for the community?
Oh, our bigger vision is always partnering with
Mm.
other agencies, with other nonprofits. We do that a lot. It is only through partnering that the community benefits. When people act as solo entities, there's no sharing of resources and there's no connecting, and the people that suffer are the community members.
Yeah.
So for me, that is always our bigger vision, is how can we partner? We have some really great partnerships coming up starting in the new year, which mean that our services get to expand. There gets to be new services in the community, and it's easier for people to reach us then. And
Yeah.
so that's always our goal.
I like it.
Yeah.
When did you guys start? What was the founding?
2016.
2016.
Yeah.
I've been in Vernon since 2007 and I hadn't heard.
Yeah, so for the first few years, we were considered mobile. So we
Okay.
worked a few days out of the week out of the library, Okanagan Regional Library, and a few days out of the week here at the People Place.
Mhm.
And then eventually we ended up with an office here. But we're considering getting back into some of those mobile services again. Still have an office, but I think being out in the community is important. It's
Yeah.
being where people are is helpful.
Just that visibility.
Visibility.
Yeah, for
Yeah.
sure. So where can people find you? Do you want to just say the website?
Sure. So our website is johnrudyhealth.ca.
Okay.
They can find us on Facebook under the same title.
Okay.
And Instagram in the new year as well. We're going to branch out into that.
Woo!
Trying to catch the younger crowd, right?
Yes,
So-
because we can't forget about this.
Yeah.
It's not an older person.
It's not.
thing.
People think that
Yeah.
we provide services to seniors, but the majority of people we see are between the ages of 40 and 60.
Excellent. to
And
know.
more are under the age of 40.
Do you
So-
think that's because we do, knowing the population of Vernon
Yeah.
and the Valley, we do have a 50 plus, maybe even boomers,
Yeah.
that's the assumption, but there is that missing link for the younger.
Quite often people experience their first health crisis in their 40s or 50s.
Yeah.
And so I think that's a piece of why we see that age group. But it's also when you might be starting to provide care for a family member.
Yeah.
So
right.
when 88% of the people we see are caregivers, they're younger, providing care for somebody older
The
who may only
sandwich.
be 65,
Right.
right? But so there's that sandwich generation for
Yes.
sure.
Yeah.
And, we want to be able to give people information, not only when they're in a crisis, but for when they are in a crisis so that they can be prepared. And that's a bit of a hard sell sometimes.
Yeah.
but
we don't like to look at it till
No,
we have to.
yes, exactly.
It's the human condition,
Yeah.
unfortunately.
Yeah.
Well, this has been amazing,
Thank
but
you.
we probably should wrap it up
Yeah,
to
for
keep
sure.
it within our guidelines.
Great. Thank you.
So thank you so much, Chantelle, for sharing your wisdom, your honesty, and your commitment to helping people live a life that's more than
Okay.
just survival. What I love about this conversation is that it pushes back against the idea that joy is only available to people with perfect health. And it reminds us that acceptance isn't resignation, it's
Mhm.
clarity. It's the starting point for building a life that you still love. So I would encourage the
Sure.
listeners to find you online. And if you know someone living with chronic health challenges, please share this episode. You never know how much relief or permission it could offer.
Thank you.
Thanks for listening. And as always, stay curious, stay connected, and keep choosing joy on purpose.
Thank you.